We will call the meeting to order at 7:06. First on the agenda is approval of the meeting minutes. Do I have a motion to approve?
Second. Judy seconded.
Okay, any discussion on the minutes at all? All right, hearing none. All those in favor, say aye.
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 Any opposed? All right, the minutes are approved. At this time, we'd like to grant privilege of the floor to Deb Reed and Lisa Norowski to discuss vaccines and health education.
Sit right here and just say it.
You can kind of come stand in the middle of the floor if you want, kind of between those two pillars so that the owl will pick you
Okay,
up.
all right. All right, so I'm going to read because I want to stay focused.
You want them on a microphone?
The owl should be able to pick. Can you guys hear her okay? Tyler, can you hear Deb?
Yeah, I think we're okay.
Deb,
Okay.
is he okay?
Yeah.
All right, great. Okay, so I'm going to read so I can kind of stay focused because I tend to wander sometimes. So anyway, good evening. My name is Deb Reed and I'm from Allegheny County. And I just want to mention I'm here representing myself. These are my questions. All right. I'm a little nervous to present. A lot of people are going to hear me. The people that really know me know that my heart is good and that I care about people, especially those who are down and out. There will be those who don't know me. And I want to say I don't mean to offend anyone. Personally, I am open-minded and I'm not advocating for or against anything, but rather to hold true to freedom to choose for oneself without retribution. How did I get here? I started participating in protests where I didn't know who I was talking to talking to local government representatives. A friend and I started talking first with Mr. Crandall, who referred us to Carissa Knapp, the county administrator. She was wonderful to talk to. Carissa referred us to the health department where my friend and I met with Tyler Shaw and Jamie Darcy. Again, another wonderful conversation. And we learned a lot about how local government works from these three people. From there, it was suggested that we attend this Board of Health meeting to ask questions and learn more. So here I am. I'd like to go through a list of questions completely before any discussion. I think knowing the full scope of my thoughts will help to figure out which questions can and should be answered and which ones cannot and should not, because I just really don't know. All right, just to let you know, I believe in freedom of choice, and there is a song out there named Welcome to the Revolution. The lyrics are catchy, but the singer holds this sign that's really meaningful to me. It says, where there is risk, there must be choice. This resonates with me, and so this leads me to my questions. And my questions are broken out into 4 different categories. There's therapy. There's questions on the masks. There's questions on the vaccine. And there's questions about the hospital and the health department. So I'll go to the therapy questions. What are the choices for people who are getting sick enough with COVID to seek health care? I know someone who went to the ER with difficulty breathing and received a Z-Pak and prednisone with successful results. Another person presented to a hospital with difficulty breathing and was sent home without anything, and then presented 2 days later in terrible condition, and they had to be hospitalized. And I want to emphasize that the second scenario was not Jones Memorial Hospital. All right, but so the question is really more, what does Allegheny County do? What is their protocol when someone is presenting to medical facilities with COVID symptoms? Like, can they expect, something for treatment? The second question is, what preventive therapies are being recommended to help curb or lessen severity besides the vaccine? Like for example, we're seeing stuff on hydroxychloroquine in combination with zinc. Or others. I mean, there's just, I'm not a medical professional, so I'm just wondering. Let me just put something else in there too. For those of you who don't know me too, I don't ask a question because I'm questioning someone. I ask a question because I really don't know. Like I don't know the answer. So I just want to make sure I got that in there before I keep going. All right, so and then I was wondering, will you explain how the monoclonal antibody therapies work? I was wondering how, if you would explain how ivermectin works. I was wondering how if you'll explain how remdesivir works. We're hearing like out in the, in the research world, we're hearing things like remdesivir causes pulmonary edema versus pulmonary pneumonia, which is what some people are actually supposedly dying of, and there's getting confusion there. So we're wondering if that's true. And then, so that's the therapies question. Like what are we doing in Allegheny County for our residents, therapy-wise? All right, and then about the vaccine. What is in the, I have a hard time pronouncing this. What is in the Comirnaty vaccine that the FDA approved compared to the non-FDA approved serums? Why is that vaccine the only one approved? I'm wondering. I don't know if you can answer that one or not, but I do have that question. And then where in Allegheny County do residents have access to that particular serum? I've asked lots of people who have gotten the vaccine and they're not getting that particular one. So I was just wondering if that one is available. The next question. Vaccine experiments are known to last anywhere from 5 to 10 years, and there are phases throughout the study. I was wondering which phase we are in for this experiment. And then the next question on vaccines, the last question on vaccines, is that they're known to cause vaccine injuries. There is a national vaccine injury compensation program sponsored by the US government in an attempt to help with vaccine injuries since pharmaceutical companies are exempt. And I understand that the pharmaceutical companies have to pay into this fund, so they're not totally off the line. But anyway, I was wondering why the COVID vaccine is not on that list. And, it's just a question, and wonder if anybody knows how that works. Then on to the masks. And so I have mask questions because I'm a teacher. And this is what I see a couple of things in my environment. So that's where these questions came from. All right, should masks be tested? Like our health department tests water for safety. We know that there are a number of allowed toxins in the water that won't hurt the population. I don't know if toxins is the right word either, but you know what I mean. Anyway, should for example, the dirtiest of masks the teachers see children wearing, and believe me, some of them are dirty. And you can't get some of them to take it off either. You can't get them to change for a clean one. Or if you do, they start sucking on it and then their hands go on the wet and it's just a mess. So I'm just wondering if, instead of worrying about that, could that be tested and just kind of put the community's mind at ease? That might help a lot. And then students are not allowed in school for COVID symptoms. And I was wondering if they're allowed in school for other issues where sneezing and coughing is occurring. And then if they have to be masked, what's the protocol for that? All right, in Allegheny County, anyway. So then the last one, the health department and hospital. So this question is related to some things I've been hearing in the community about the number of hospital beds. Is there a way to increase the number of beds in a hospital from 22 back up to the 49? Now, if that's not the case and that's wrong information, then just forget about this question. But if it's true, could we ask the state for support? Because if, you would assume that if you go from 49 to 22, it might be because of there's just not enough people to work there. I really don't know. But if that's the reason, could we ask for support? Hopewell mentioned that the National Guard is there. I mean, maybe they could help, and that might help with the EMT issue too. I don't know. 2 more questions. Is there a way for the health department to look more holistically at Allegheny County citizens with health needs? There is sadness in our community for many reasons. It stands to reason. Just look at what we've been through the past 2 years. And there is a divide between people who see vaccination as an obligation and those who see it as a choice. And it's causing anxiety and sadness. Can the health department help with that in some way? For me, I believe someone should have the freedom to not want to take a vaccine because of vaccine risk. I believe that people ought to be able to practice their faith. And I believe they simply should be able to exercise the freedom to choose. And they shouldn't have to feel sad about that or singled out. And people are being singled out in places. It's just kind of sad. Can our health department do something about that? I mean, I know there's health education out there and ways to, work with that. And the last one kind of piggybacks on that, where HIPAA laws were created to protect from situations where outcasting might be created. I think, I might be wrong on that, but in this case, is that a violation to know someone's vaccination status if they're being singled out? I don't know. Yeah, and the last one is for Chris off the side. Yeah, so I don't know if there's any of these that could be answered tonight, or if we need to think about that. I just really did want to pose it in a public forum though, so people could hear the questions being asked, and for everyone to know at the county level that people are interested in more than just knowing about vaccinations.
Thanks, Deb. I think those are some really great questions. We appreciate you bringing that to our attention. If we can get those questions in writing, I think that would be great. You have my email. I'd be happy to send it on to the board members and get their thoughts too. If there's anyone that wants to jump in on any specific question, feel free now. But I wanted to make sure we followed up more comprehensively with you, Deb, to get you some answers to your questions.
Tyler, I just so appreciate that. You're great to work with. All right. And so thanks everyone. Yep. Yep, you're welcome.
Oh, Tyler, I really didn't hear any of the questions. The voice was very muffled, a little bit far away for me. I don't know about the other members. I hope someone wrote these questions.
I did, and I'll have Deb send them to us in an email, and I'll send them out to everyone.
Okay.
We're talking about for just a second, because that, Dr. Passas, that is actually a problem in the schools too. Teachers have to talk in mass all day long. And if you can imagine, you can't hear me very well, and I've got a classroom full of kids. Some of them are only 5 years old and they can't hear me. And so we're talking through masks that they can't hear. They're pulling their masks down so they can talk. It's hard. So, and I do this all day long. Like, I don't take my mask off all day, and I'm talking all day to children. So just as you guys try to figure things out.
I have to lip read as well because of my bad hearing. I fully understand what you're saying.
Yeah, so just as you guys are trying to work things out, that is not a complaint, but rather an explanation. I would say a complain or an explain is not a complaint. And hopefully people understand the difference. Thank you.
Thanks, Deb. Is Lisa, does she have something she wanted to present too?
Yeah, yep, she's coming up.
Okay, perfect.
Hello, my name is Lisa Narowski of Wellsville. I would like to start by expressing my appreciation for your time while I speak here today. My hope in speaking here is to illuminate some issues that I think are extremely important and facilitate an opportunity for an open discussion that is based on facts, logic, and liberty. Most of all, I would like to encourage transparency. I will include a copy of my references so everyone can utilize them for further discussion. I would also express my gratitude for everyone working here to help offer the best options for individual health. I'm sure we can all agree that we're desperately trying to increase health, save lives, and reduce the burden on our healthcare system and its workers. We know we cannot continue down this road, but we are preaching the same message, expecting different results, which of course is the definition of insanity. I would remind our elected and hired officials that they do not work for the CDC, the NIH, the FDA, or pharmaceutical companies. Rather, they work for the citizens of Allegheny County. I would ask that they respect our personal decisions and inherent bodily autonomy. We are currently in an environment where we are not having an open discussion of the facts. We expect people to agree with the main narrative, and if they do not agree, they are dismissed as misinformed and irresponsible. We are mandating medical treatments without acknowledging the risks. People are being forced to quit their jobs based on cherry-picked evidence. Shouldn't we make people aware of all options as well as the risks and benefits of each option? Giving people the liberty to make the choice that is best for them encourages personal responsibility and deepens further discussion. I know the amount of information is overwhelming, and it is easy to adopt a complacent acceptance of a highly promoted narrative, but the current narrative has yet to stand up to important research. Vaccines are being promoted with an unknown long-term safety profile. In less than a year, there have been at least 10,000 deaths from the people who have had COVID vaccines, and thousands to hundreds of thousands of adverse events, according to the CDC. Expecting to save lives and increase health while exposing people to the risk of death is nonsensical. Vaccine passports are extremely unethical and promote discrimination. Natural immunity is being ignored. We should not force vaccines on anyone when the evidence shows that naturally acquired immunity is equal to or more robust and superior to existing vaccines. Masks are demanded without an honest look at the efficiency or the risks of wearing them. Surgical and cloth masks are unlikely to filter the SARS-CoV-2 virus. Some risks of wearing masks include decreased oral health, headaches, impaired learning in children. Vitamin D deficiency is so widespread and so predictive of bad health outcomes, it has itself been called a pandemic by many scientists. In this era of abundant and prolific public health pronouncements and recommendations with regard to COVID, I have found none that advise the populace to check their vitamin D levels. What I do find are more than 11,000 results when I do a search on Google Scholar limiting the years 2020 and 2021 for vitamin D deficiency and COVID. Standard doses of ivermectin have a nearly unparalleled safety profile historically among medicines. Numerous studies also demonstrating the wide safety profile of high-dose ivermectin in COVID and other diseases. Ivermectin helps treat COVID at the same time that it helps keep patients out of the hospital, as it is an easy prescription you can take at home, which would lessen the burden on our healthcare system. Ivermectin can be used as a prophylaxis in hospitals and in nursing homes by healthcare workers or other patients, as well as in the household with an infected individual. Ivermectin can be safely given to children. Ivermectin can help with long-term COVID. People who support ivermectin do not have any financial incentive, as the drug is out of patent and much more affordable than other options. I will end with a quote from Justice William Blackstone in 1765. For it would be dangerous to allow any private man or even any public tribunal to be the judge of this common good and to decide whether it be expedient or no. Besides, the public good is in nothing more essentially interested than in the protection of every individual's private rights. Thank you.
Thanks, Lisa, and thanks for sending your speech along with your references ahead of time too. We did send that out to the board members, so hopefully you all had a chance to get a look at that. I did check into some of those references too, and I'll send along some comments I had about those as well. Did anyone want to address Lisa or Deb at all? Feel free.
Lisa, it's Zahik Assas here. I don't know if you can hear me.
Yes, you can.
Lisa, thank you very much. I love the idea that you sent us a copy of the letter. Do you mind clarifying to me, you mentioned something about 10,000 people died after the vaccine. Are you hinting that the vaccine killed 10,000 people?
That came straight from the CDC website, so yes.
I'm sorry, I can't hear you.
Yes, that information came straight from the CDC website. So unfortunately, that is accurate, and it's actually probably much likely a larger number. Unfortunately, the system isn't extremely accurate. You know,
And Lisa, I'm not contesting your opinion, but you know, if I may allow to quote Jesus, if you don't mind. Now, Jesus did not say, do to others whatever you would like. Jesus said, do to others whatever you would like them to do to you. So when you take the sentence out of context, you get a total different meaning. In the CDC, when you read the death, they say 10,128, whatever the number is, of deaths were reported after getting the COVID vaccines, because when people die, it's normally documented what vaccines, what medications they are on. And if you continue reading that article, they will say, and I wrote it down, that's why I thank you for. So that in the period between December 2020 and November of 2021, so that's 11 months, there were 10,128 reported deaths after 459 million doses of the vaccines were given. I'm hoping that we're at the same article. So when you do math, it turns out that among the people who got vaccinated, the people who died were 0.0022% of death. And then the CDC says, we don't know what killed, why those people died. Some died of car accidents, some died of heart attacks, some died of cancer. So those are not vaccine-related deaths. So I think just so that we clarify your point, those were not 10,128 people who died from the vaccine.
Say that isn't directly related though, is also
So
like
it's
obviously
not-
we.
So it's not do to others whatever you would like, it's do to others whatever you would like them to do to you. So we have to finish the sentence. But it's only logical, and you know, your point is well taken. A lot of the points you mentioned in your letter were very valid. Immunity, vitamin D, zinc, you know, everything you mentioned make lots of sense. But we just need to be a little bit careful about how we say things. So the CDC did not say that the vaccine killed 10,128. I just wanted to comment on that. And the other thing about the mask, Lisa, there is something that's social reciprocity. If I say good morning to you, you say good morning back to me. If I say good night, you say good night. If I wear a mask to protect you, I would only expect you to put a mask on to protect me. You know, I really don't want to get sick because other people don't want to wear a mask. I still have lots of patients to treat. My kids did not graduate from college yet. I don't want to die because someone did not wear a mask. If I'm wearing a mask to protect everyone around me, it just makes social sense and kindness to just put a mask around me. This is it. Thank you.
If I reply, I just, you know, at some point, it's just, again, like, according to the study, the masks do not stop the SARS-CoV-2 virus. So it's not necessarily something that is protecting anyone. Like, I understand it might make people feel better, but in reality, it doesn't do what people think that it does. It has a minimal effect. And in hospital settings, I work in a hospital office. I understand how that works. I also understand how PPE works. And there are different settings. If you're going to a bar and if you're going to a hospital, those are completely different settings. And I believe that they should have different requirements.
I'm just going to state, Lisa, I appreciate you bringing all this information. We've spoken before, something with Deb. And it's good to get other people's perspectives. Kind of going on what Dr. Casas was saying is, no matter what our personal beliefs are, we have an obligation to each other, to our citizens, to our community, to our family members. And it's to see that side and make sure we're doing what we can do the best for the community as a whole, for Allegheny County. And as Deb said, you know, that this community is split right now, and that's not easy. But I do want to say that this is part of the issue that we're having trying to educate people, because something like this, where you say, oh, there's over 10,000 deaths, but you stop there and don't say out of 459 million vaccines, and this is what it comes to. So people are getting half of the information. And as a society, we have to stop doing that. I see it every day on Facebook where somebody gives part of the information and not all of it. So it's hard to educate people and give them choices when they're only getting half of the information.
I understand it's a small number compared to the amount that it's been given, but at the same time, it shouldn't be ignored because it is an issue if we're trying to prevent death, and yet we're exposing people to a possibility of death, then that just makes no sense to me.
Yeah, and again, I think Dr. Casas hit on it well. Is after I spoke with Tyler, I went and read some of the references too, and again, that 10,128, and there was, I remember on the news in Buffalo, Lockport area, somebody had their vaccine, pulled out, got into a car accident. Was it the COVID shot? Did they just get in an accident and that's how they passed away? So those numbers are inclusive of that.
And
So
those numbers can also be included in the total COVID deaths as well. So unfortunately, we're at a spot where we don't have a great system for following these risks and injuries and deaths. Like we're just, so if we can figure out a better way to follow these and to track them and to just narrow down, I guess, the actual cause of things, that would help people as well. I understand that's that's a large ask, but
unfortunately on our level, I don't know if
right.
Tyler wants to speak on this, but what we get from, death certificates, and that's all we can go off of. I mean, I'm not a doctor. Any one of the doctors in this room can give you more information than I can on that. But again, we have an obligation to, try to save lives. And as you mentioned with the mask, yes, they're not made for viruses. They're not, a half face or a full face respirator, but they help. And that's
they also
the
have
message, is they help.
plenty of risks. Like again, like decreased oral health, like that's a large issue. Like impaired learning in children, also a large issue. Like we just can't just say like, oh, it's just fine and there's no issues with it. Like there are issues that aren't being addressed. And again, it should kind of be up to each individual person to assess the risk benefit scenario in the environment that they're in. Again, if they're in a nursing home, I'm sure most people would agree to do that. But if they're like, then you are kind of in that environment on your own choice. Like, it shouldn't just be a blanket type of
Lisa,
thing.
can I ask you this question? Do you believe that the better of the whole is more important than one person's?
I believe that individual liberty is the most important thing. And it is up to each individual to decide how they want to fit into the whole. No one is obligated, just like Justice Blackstone said, the common good is most highly regarded in protecting individual private rights. And I mean, that's kind of how the US got here, is because we want liberty. We don't want large groups of people deciding what everyone should do. We want individual liberty. And I think that's something that's extremely important, especially in this environment of, where
Simon, did you have something you wanted to mention?
Well, I'm listening to her, and everything's going through my mind here, and there's a lot I agree with it. It's my own personal feelings, but that's the other thing with that thing, Lisa. We have last time we talked, we had 36% of the county vaccinated or something like that. If I remember right, 37%, 38%, whatever it was. And then our COVID rates went sky up again. And you can't, I don't agree wearing these things. I hate them. And I don't think you do that much good. But on the other hand, if you're not going to get the vaccine, you got to try, you got to do something. To answer you want liberties. You didn't finish that sentence. Give me liberty. Or give me death. That's your choice. That's the way I look at this thing.
Yeah.
And when things happen and people die, nobody should get upset about it because you had the choice to protect yourself and you threw it away. I had a good friend of mine die 2 weeks ago, 61 years old. I had the same discussion with him. I went to his funeral. You know, but he had his choice. He wouldn't do it. You know, so you want your liberties, and I agree with you. Everybody should have their liberties. But then when things like this crop up and you see other people dying, you say, is that right? Should somebody step on his throat and say, no, you kind of have this?
And that's why I came with some other solutions besides vaccines, such as vitamin D and ivermectin. Ivermectin is
Well, ivermectin
done
is only, that, as far as I'm
extremely
concerned, that's
well.
only good after you get it, and it's good
It's
for,
good for
for getting-
prophylaxis. It is good for long-term COVID. It is good in all scenarios. It's extremely safe. There's zero reason why we shouldn't be prescribing
I
it.
understand it. I
to
just ordered some, I
everyone
just
all
ordered
the
some
time.
this morning from pharmacy in Canada.
Yeah,
You can't get it here.
it's easy to make. It's out of patent. If we requested it, I'm sure it could
Well, I'm
happen
not, you know.
just
I'm not
as
gonna get
easily as
into
the
that.
vaccines happen.
But on the other
It's
hand,
just a matter of,
that's my next line of defense, because I don't know if I want a booster shot. I've had all the shots.
yeah, like,
But I don't
there's
know if I
not
want to have a
much
booster, but I got
research.
my ivermectin.
Yeah, there's not much research on if you had another booster and another booster, and like, at this point,
And we had this last
That's the line.
discussion last time I was here about booster shots compared to natural immunity. And somebody said from before, well, natural immunity is only good for 90 days. That's wrong.
it's wrong.
That's wrong. And
So
those
if I can jump in a little bit too, on the ivermectin reference that you included, Lisa, I did look into that article as well. That was reference number 20 for the board members. It did say there was quite a few limitations to that ivermectin study. And one of them was it lacked the power to detect differences in clinical outcomes. It did clearly state in there, the findings should not be used for clinical or public health decision-making and should not be presented to a lay audience without highlighting that they are preliminary and have not been peer reviewed. So unless you have some other documents, and this study was conducted in Argentina, not in the United States, certainly not against conducting those type of studies here in the US. Same with the natural immunity. The CDC is working on those studies. I think those are important studies. I don't think the 90 days is enough, but again, that's what the evidence for the mass majority of the population, that's where they're fitting into. But I think we'll see more information come out on natural immunity. And I think that you brought up some great points. I mean, that just needs to be, some of the stuff needs to be studied further. I agree.
I don't think anyone would disagree with you on that or individual liberties. It's just that at what cost to others. And
But can I just mention that because the cost to others also includes those who are not wanting the vaccine and feeling sad, and there's a lot of anxiety, the issues that are actually affecting people's lives in several different ways. I cite some example, but I think I'm just gonna keep people's lives private. But
And
so
Deb,
there is
that can go the
other
opposite
side.
way too. I get picked on in my family because I am vaccinated,
You know.
and my family is not anti-vax, but
Yeah.
the same alternative studies and stuff. So
Yeah.
it goes both ways. I get picked on horribly because I'm vaccinated in my family. So
Yeah.
it does go both ways, and that's gotta stop. That's just
Yeah.
not being a good human being.
Not being good.
When people are making fun of each other because they're either vaccinated or not vaccinated. So
Yeah, we have to not do that anymore.
Yeah.
Yes, so, thank you.
thank you both.
Yeah.
I'm just speaking some sense. There's a lot to consider, and Tyler and I have these conversations on a daily basis of when are we going to see more, and when is more research going to come out on alternatives, and we're hoping just as much as you guys that we see that information. So
one of the references that I have, just because it's local and I find it compelling, is a nursing home in Buffalo that is going against IV or FDA recommendations and treating people with ivermectin, and they're having good results. Like, I understand these things haven't been studied for whatever reason. I'm not going to go there right now. But there are, it might not be peer reviewed and all these things, but there's countless amounts of clinical research from the US, from doctors that are just going, against what the FDA recommends. And even in just India, Uttar Pradesh is having fantastic results. The Board of Health in Japan just recommended ivermectin to anyone who has COVID. Like, there's other countries that are doing things that I don't think have the financial incentives that we currently have here. So it's unfortunate that we're being limited and held back, and that's just hopefully some more discussions that we can have as to why that's happening and how to move past it.
Lisa, I think we're too early in the game with ivermectin. If you use it and somebody has COVID, we still do not know whether their natural immunity is going to protect them for 6 months, 9 months, a year afterwards. The way I understand it, if you have a more mild case, your immunity lasts a shorter period of time, maybe only 3 to 6 months. If you're very sick with it, you may have immunity for up to a year. But the fact is, before any vaccinations came out, we've had 4 mutations of the COVID. And so without vaccinations, I really think you're just going to keep kicking the can down the road, and you're just going to get another variant and another variant. And especially with kids in schools, if we take the mask off of kids in school because we're worried, they're just going to have more mild cases. They're going to bring it home, and we're going to have, more 30 to 100-year-old people dying. So, my feeling is vaccinations have been proven for a long time now, whether it's measles, mumps, chickenpox, diphtheria, to make a difference in the overall health of everybody. And I think we have a war on our hands with this COVID, and sometimes we got to give up a little bit of our personal liberty for the good of all. That's all I got to say.
Dr. Felsen.
Thanks, Dr. Felsen. I think we'll move on. Thanks, Lisa and Deb. And Deb, if you can send me those questions, we'd be happy to answer those and get you some answers to those questions. Some of them probably I'll route to the hospital, but I can get you an answer to those questions.
So does that doctor not have COVID anymore? I mean, does he think it's going away?
No, I think he said just the opposite, that Dr. Felsen, she was asking if you thought COVID was going to go away. I think you were saying just the opposite. It's just going to keep mutating and keep going.
We're probably going to. I just read a wonderful article in Nature written by about 30 virologists, and I think we're going to see it for another 3 to 5 years at a minimum. And it'll just be what mutation is out there, and we have to adjust to it, just like we change flu vaccine every year.
Yeah, that's what I was wondering about. Okay, yeah. All right.
Dr. Simons, did you have something else you wanted to mention or no?
No. I wasn't suggesting that ivermectin was a cure-all, but for that person that's right at the edge of going over and dying, I've seen it work on 2 different friends of mine, one from Batavia and another one from North Carolina. And it brought them back. Within 48 hours, they were back up and running again. And they were on the verge of really being on a ventilator. So it does, in these cases, I know it does work. But to take it as a prophylactic thing or anything, no, again, like Joe said, that's only kicking the can down the road. This virus is a virus. It's going to be like the cold, like the flu. It's going to be part of our lives from now forever. It's just a matter of how we deal with it. And to say, I don't want a vaccine. Well, I didn't want a shot either. Nobody wants a shot. But the thing of it is, it's a smart thing to do. It's whether, I think the government said you had to do it. It's what, piss people off.
Yeah.
If they just said, we want you, we really encourage you, they'd come at you a little softer, but it was, they were gonna hold you up against the wall and put a needle in your arm, and people just said, no, you're not doing that to me. I feel sorry for them, because now people have dug in, and it's become part of their whole being to resist this flu thing. And if they keep doing it, there's a good chance they're gonna die from it.
And unfortunately, Dr. Simons, you're right. We see those numbers, we hear these stories on a daily basis in our office, that until somebody in somebody's family gets super sick or passes away, that's when somebody finally decides to go and get vaccinated. And it's sad that it takes somebody passing away or being hospitalized for somebody to make that decision. But I also think that it blows my mind away that somebody will not get the vaccine to protect themselves, family members, community members, but they'll get a vaccine so they can go watch the Bills game or go to a concert. That blows my mind.
Well, there's a lot of things that happen in government every day. It blows my mind.
Okay, yeah, let's move on the agenda. Just wanted to give everyone an update on COVID-19. I'm sure you all have seen the mask requirements are in place for indoor public spaces until January 15th of 2022. Right now, 46.3% of our population has one dose, and 42.5% of our population has a complete series. So we are still in last place at this point across the state. But not so far behind some of these other rural counties in comparison. 7-day positivity rate was our average is 10.9%. And just yesterday we had a 15.3% positivity rate, which does still classify us in the high community transmission rate. And likely that number is higher due to the at-home test kits available to individuals. So how that works is if someone tests positive at home, they can call into our office, send us a picture, and we will log that into the system. The state can't see those numbers necessarily unless they're pulling it from a second system that they have access to. So we're anticipating that number is probably around 18 to 20% is the actual positivity rate in Allegheny County based on those at-home tests. We're getting anywhere from 20 to 30 of those a day, and that's just what the calls we could return in one day for those. Any questions on COVID-19 updates, vaccination updates, anything like that? No? Okay. Personnel changes in the health department. So welcome April Worth. She's our new Director of Patient Services. We also hired Sarah Johnson as one of our registered nurses who will be primarily working in immunization on our reproductive and sexual health program. And Chuck White, is Chuck there tonight, Jamie?
Yes.
Right here.
Okay, yeah, Chuck White is our new environmental health director, so welcome Chuck White. He has an industrial engineering background. And Sherry Abbey, which some of you may be familiar with, she has come back to our department since last quarter as our MRCO in our Children's Services program. So we're happy to have some additional staff on board. Certainly welcome help for Jamie and I as well, because we were pulling our hair out a little bit for a little while. So welcome everyone. At this time, we'd like to present Judy a little certificate, and I'd like to say a few things about Judy. As most of you know, Judy is retiring from the legislature. She did not run again. So this will be her last Board of Health meeting. Just wanted to share a few words about our Board of Health legislative representative, Judy Hopkins. She's been a champion of not only the health department, but for human services, serving as a legislative chair for this robust committee. She has brought leadership, guidance, and most importantly, empathy to each and every position. Judy, we're grateful for your support during some of the darkest days of the pandemic. She brought some nourishment and goodies for our staff and certainly raised their spirits. Thank you, Judy, for your partnership and leadership, and we would like to present you with this certificate.
Thank you, Judy.
Judy, do you want to say anything?
Of course, yes. I just want to say thank you to all of you on the Board of Health, and especially to our Department of Public Health personnel, and Tyler, especially taking the reins at a very difficult time. And you've done that with grace, with efficiency, with planning. And it's been a real joy for me to work with all of you. And I appreciate all that you've done with the midnight hours and the weekend hours and the constant dedication to this, as long as our medical staffs throughout the county, our doctors, nurses, our first responders, our technicians, all the people that have been so affected by this. And I think it's been a real team effort to deal with it, and along with all the other responsibilities of environmental health and rabies and lead and all kinds of things that your department deals with. So it's been an honor and a privilege for me, and I thank you very much. I will miss you all. Thank you for the certificate.
Enjoy.
Thanks, Judy.
Have some fun now.
Can I ask a question? How come you took your mask off to speak?
Because I'm sitting over here far enough away from
I
everybody.
know, but you see, when I'm in the classroom, I have kids that far away, I still have to talk through my mask.
Thank you, Debbie, for that comment. I'm not going to go into that.
But I,
Thank
you know,
you.
I was just wondering, you know, because here's the thing, either they work or they don't. And that's our point.
I'm not getting into that tonight. Thank you very much.
I'm sorry to put you on the spot like that, but I just really needed to ask that question in that moment in time, because it matters. If we're being asked to do something, it matters that we all do it.
Thank you for your opinion. I
And
appreciate
thank
that.
you for yours.
Thank you. Good. Thank
Yeah.
you.
You
I
can be
think-
mad at me for asking that question, and I'm sorry about that. But I had to ask.
You have the right to ask that question. I have the right to say what I just said.
I
So
know,
thank
I
you.
know, I know.
I
would
move
like
that
the
we
answer to that.
continue with the.
Thanks, Deb. Moving on, April, our Director of Patient Services will now do her report.
Hi, guys. I'm new to this position, so some of the reports I'm going to give to you happened before. They're from the last quarter. What I do want to say is, though, before I start giving you a few, some information from the last quarter, is that starting in this position, I have made phone calls to some of the other counties, trying to get some education pulled in for a couple of our new additions here. And a lot of different counties have either greatly reduced some of their programs or are not doing them at all. So we have been able to continue our programs that are also important to public health aside from COVID. So I just want to let you guys know, I was surprised calling, trying to get a little bit more education, how much COVID has slowed down other pieces of public health, but not here in Allegheny County. We've been doing very well. We had last quarter 143 immunizations that we were able to provide with the program. Now, it will also include a total of 491 COVID vaccines, both first and second doses in that quarter. This is pre-booster, so we're not looking at that time. Our family health, the reproductive and sexual health clinics, we have continued our regular scheduled clinics. So we did a total of 5.5 clinic days that were held last quarter. We saw 58 patients, over 30 STI investigations were conducted through the health department at that time. Lead poisoning, I know that it's dropped down to 5. We used to be at 10 that we're looking at in the program, so we have seen our numbers grow. We're currently monitoring 47 children. We are continuing to send out the reminder mailings for children who are about to turn 1 and 2 years to remind them to be tested for lead. Last quarter, we mailed 85 lead testing reminder letters for 1-year-old and 81 reminder lead testing for 2-year-old children. Communicable disease, we had 198 reports conducted in the last quarter to include Lyme disease, Hep B and C, Giardia, Legionella. So again, we're continuing all of our other programs amidst COVID. We do not have any complaints, accidents, or incidents to report at this time.
Tyler,
The Lyme disease, how prevalent was that this year?
So Melissa handles both our Lyme disease and lead, and she said she saw an increase as compared to last year. I don't have an actual percentage on it, but we were sort of talking about that back and forth, and she felt that there was a large increase, and she also followed Lyme last year. She's been with us for a couple of years.
Because it was hot.
It was warmer this year, yes. And I think more people are being tested too.
Tyler, may I clarify the mask for the teachers?
Sure.
Deb, may I clarify the teachers' masks?
Sure.
Last year, when schools were working kind of half days and there was a lot of virtual learning and students were not coming to school every day, you know, some students were coming Mondays and Tuesdays, and some students were coming like Wednesdays and Fridays. The students were spaced out 6 feet apart. And when they were sitting 6 feet apart, they were okay removing their masks. But this year, when the state decided we're gonna open the school for everyone, it's gonna be school like normal, and students are gonna be 3 feet apart, it was decided that everybody's wearing the mask all the time. But the rule continues to happen that if you are 6 feet apart, you know, like when the kids are eating, or it's okay to take off the mask. Mask breaks, and so during mask breaks, we are 6 feet apart. But when students are clustered together, when the classroom is full and functioning at full capacity, this is why the point came up to be masked all the time when students are seated. I know it's frustrating, but that was a way of having an almost normal school year. That's the reason why you teachers, same thing like doctors and nurses and hospitals, we are forced to get the vaccine whether we like it or not. You teachers are also paying the price by being asked to wear your mask all the time. We're all in it together, Deb.
I know we're all in it together, and I really don't have a problem wearing it all day. I just had to ask that question in a moment, because there are several people in the room. We are not allowed to take our mask off to give instruction. We have to talk through it. Some days, like by the end of the day, and I've talked through this mask all day long, and my voice does raise up a little bit, you know, because it's hard, and you're out of breath. It's just, anybody who hasn't done that ought to give it a try. It puts a real perspective on having to wear a mask and talk for a job all day long. And Judy, I'm really sorry to put you on the spot right there, but I just really needed to, because it's interesting. And we've watched in this chamber, I've watched some meetings where it's fuller than this, and people take their mask down and they say what they have to say, and then they put it back on. And teachers see that and they talk in the classrooms like, why can't I take my mask down if I'm far enough away from the students, say what we have to say and put it back on? And we just don't understand that difference. So
we're trying to
I
lead by
didn't put you on
example
the
though
spot. I
too,
really did.
right? I mean, you're teaching children.
Yes.
So, I mean, you want to lead by example as well. So if you're taking your mask down, whether you're 6 feet apart or not, and they see you do that, then we're not teaching them either. You know, it's also leading by example.
And exactly. I've got a
Right, but
legislator.
she's 6 feet apart. What I'm saying is, if we're doing that all the time, though, you're teaching your children differently. And it's hard for them to understand this. It's hard for all of us to understand this. I mean, it really is. I have children in the school system. I was an OR nurse. I wore one of these way before COVID all day long.
Yeah.
So this isn't anything new to me.
Yeah.
I wore an N95
Yeah.
6 months ago,
Right.
all day long, all day.
Right.
It didn't
But
come
if-
down.
But if we're at the top, as a legislator is, I mean, there's certain things you expect, and when you see somebody saying, I'd like you to do this, that they also do it too, even if it's 6 feet apart, you know what I mean? So I just
Can
think-
I answer that? This is Carissa speaking. I can actually answer that question. There is very specific guidance by the state for individuals that are appearing on camera. So obviously, when we're in the boardroom and we're televising this and live streaming, we're appearing on camera, you may remove your mask when you're speaking if you're more than 6 feet away from other individuals. That's a very specific rule. That's why Mrs. Hopkins knew enough to take her mask down and put it back on when she was speaking. That is because that's what we do in the boardroom when we're on camera. So that is guidance. That's on one of the FAQs that the state just put out on the new mask rules.
And
Thanks,
also,
Kristen.
Deb, in state ed guidance for the 3 foot, as Dr. Casas said, is it was to get more kids back in the classroom because they couldn't social distance. That's why last year they could take their mask off if they were 6 feet or more apart, and this year they can't.
You see,
And
I'm
we
not
were finding-
questioning that part. I'm just questioning.
Yeah,
I'm
but we
just
also
questioning
found
that.
that teachers
Yeah.
in tracing don't just stand at the front of the room. They walk around, look over the kids' shoulders, are
Yeah.
interacting with the kids. So that's another reason why the masks are full-time in the classroom.
So, but that's gonna open up, like, if you go into a store, there's nobody in there, I can take my mask off because there's nobody else around, yet there's a mask requirement. I mean, I just think that opens up a whole can of worms. Either we wear our masks or we don't. You know what I mean? I like this, there's this exception for this, that exception for that. It just causes confusion. And that's my only point.
For
Tyler,
a teacher,
do we
for a teacher, you get confused awful easy.
There's a lot of different rules and regulations going on, and it's really hard to follow that bouncing ball.
Tyler, do we need to go into executive session for?
Now, we'll finish your updates, Jamie, first, and then we'll go into executive session.
Okay, so I will speak for environmental one last time since Chuck's still fairly new. And the only things I really wanted to update you guys on is rabies and lead. Our lead cases are quite high again this year. In 2021, we've had 20 new cases. We've closed 12 cases total, and we just had 4 new ones that have came in over the last week. In 2020, we had 11 new and only closed 7. So 36 versus 18. So double the amount that we had last year. Last year was, I think it was, we had 4 the year before, so 4 times the amount. So our lead cases continue to climb. Last year was a little bit different because we couldn't even go out to the households because of COVID until July 31st, I think it was. So those lead cases just built up and built up for half of the year. So the lead team, particularly Bill Bentley and Dustin Quinn, especially Bill, are doing a wonderful job at catching last year's cases up, starting to get those done, closed out. We have only 35 ongoing in the 4 new, so a total of 39. And that's, our number is lower than the nursing side, the clinical side, because those, we're waiting for those kids. The household has been, issues have been fixed, but we're waiting for their blood levels to fall below the 5 so that they can close them out on the clinical side. So for having so many cases, our environmental staff has done a wonderful job at catching last year's numbers up. Rabies, good year rabies wise as far as several aspects. Vaccinations this year, we have to hold the 4 vaccine clinics as part of our grant, and we had all 4 of those and vaccinated 757. So exactly 5 more than the year previous. We had 154 animal bites in 2021 so far, and those all get investigated to see if post-exposure has to be done, if there's an animal involved that needs to be sent off for testing. We actually sent 33 animals in 2021 for testing to Wadsworth, and we've had 0 positive rabies cases in Allegheny County this year, which is wonderful. And we've also only sent 11 people in for post-exposure treatment, which is way less than last year. Last year, I believe we were at 42 people we sent in for treatment, and obviously that cost to the department, to the county, was substantial. So, so I think the education is working. You know, we put out Catch the Bat, and we educate the public on, you know, not touching wild animals, not picking up stray cats and dogs, and reporting it, and catching the animals so that we can send them in to get tested rather than treating the people. So a good year on the rabies side too. So any questions from any of the board members?
Are you worried, Jamie, now that there is no point of care for lead testing? Are we going to see a false drop in cases? What are we doing so that parents actually take their kids to the lab at hospitals and do the test at the labs because they're not being able to have it done at the doctor's offices anymore.
Yeah, so Dr. Casas, April might be able to answer some of that, but I'll kind of step in on what I know is Melissa makes that contact on the clinical side with the family and does the educational piece. Depending on what their blood level is, they have to follow that up with a venous, as you know. So because the finger sticks can be so they can vary a lot. So we've had some challenges this year. I know Melissa did while we were in that transition period before April come along, that she had a hard time getting some of those parents to take their kids in. Depending on the level, that's either every 3 months to get a blood draw done. Some of them require a monthly draw. If they go above the 25 marker, I think it is, they have to do it monthly. But I believe that's settled back in. I have not heard anything from Melissa or from April saying that Melissa's having any issues with getting parents to take their kids in.
Are we still sending letters at 1 year and 2 years? Because those point of care machines don't exist anymore. So now the parents have to actually go to a lab to have that first lead drawn.
Yes, all of the letters went out.
We are still sending them.
Yes,
Can you
yeah,
say that?
we went back to that, Dr. Casas. I think April had reported we had sent out 84, 85 letters.
At 1 year and 2 years, or just at 2 years?
Both 1 and 2.
Thank you.
And 2 years. No.
And certainly we could look at point of care as a screening tool. I know we've talked about that in the past, but that was kind of put on the back burner because of this venous draw that was a little bit more accurate. But you know, understanding the complications and it's difficult. It's very difficult.
Yes, and Dr. Casas, just as a side note, a lot of our new cases this year, I roughly kind of ran through the list, and out of the 39 new, 11 of those were transfers from other county, which is quite a large number compared to the last 2 years. So that's a lot of people moving into the county, these children, and then now we have to start tracking them in their new home and track the child because of movement from another county. So that's added to the number.
So maybe it's a good thing that they moved here.
Yeah, because we're going to take care of them and get everything fixed up.
Is it lead from here or is it from bad water piping? Or is it sourced?
So we do soil sampling for along the drip line in the yard. We do with the x-ray gun, we actually touch every painted surface inside and outside of the house, and we test the water. And in most cases, it's paint. Rarely do we ever get a bad water or a bad soil sample back. But what's holding us up too is, you know, the final clearance wipes take 3 to 5 weeks to come back. And if people don't clean up well after they've done all the work, those dust sample wipes come back too high. They got to clean again. We got to go out and sample again and wait another, you know, 4 or 5 weeks for those to come back again. So it can be a vicious and long cycle. Anything else? Okay, Tyler.
All right, at this time, I'd like to entertain a motion to go into executive session to discuss a medical history of a particular individual.
I so move.
Dr. Casas, and a second.
Judy,
Say that again.
second.
Okay. All those in favor, say aye.
Aye.
Any opposed? All right, we are in executive session. Keith, if we can keep everyone on the Zoom call, and then I'll let Brian and Jamie escort anyone out that at the meeting that doesn't need to be there as well. Keith, there's no one out. There's no one else in the waiting room, right? Besides, I can only see these 6 tiles here.
Yeah, there's no one in the waiting room.
Perfect. Okay. We all can
Is
stay.
April staying with us?
Yes, April will stay.
I just want to say hi to April. Welcome in.
Hello?
You can come in front of the camera.
Okay.
I don't know if the hall is doing it right tonight. I've
this-
seen it a couple times. Just go very shallow here.
Hello?
Welcome to the Department of Health, April.
Thank you, I appreciate that.
Jamie, give me the okay once we're all clear.
Good try, Chuck.
I wasn't sure.
He's trying to escape.
Oh, I know.
I'm just waiting for Bree to get back up to her seat. So okay.
We are out of executive session. If they're still outside, they can feel free to come back in if they'd like.
If they left, whatever.
No.
Bree's gonna check and see if they left or if they're on there.
Okay, yeah, we can move on. So we talked a couple meetings ago about officer appointments, so I still want you all to keep that in the back of your mind. Whether that's Dr. Cusimano continuing on as president and Tim as vice president, or if you wanted to appoint different officers, we need to make some of those decisions, either at this meeting or at the next meeting.
I thought last time we all agreed that Tim was going to be the president and Dr. Cusimano the vice president. Didn't we agree with that?
Tim declined the presidency. He feels like a physician should be at the helm. I don't think he didn't disagreed with continuing on as vice president. Though.
Like quiet in here, you guys.
Silence.
What's wrong with Leo staying on as president?
There's nothing wrong. If he wants to stay on. Dr. Simons asked if Dr. Cusimano can stay on as president.
No.
And Dr. Cusimano said no.
I have the original contract here, April 6th, 2016. So for 6 years. July 7th, 2022.
Dr. Cusimano has served for a long time as board president.
He's done a fine job. Done a great job. What's wrong with Joe Felsen doing it?
Dr. Simons nominated Dr. Felsen.
I second.
I'm leaving tomorrow and I won't be back for 4 months. That's the problem.
Lucky you.
I don't think my Zoom works in South Carolina anywhere.
Well, I think, everyone can kind of think about it, right, Tyler, and talk amongst themselves and, because we don't have to make a decision today, right? Dr.
We can.
July 7th, 2022.
Yeah, so Dr. Cusimano said his goes through July 7th of 2022.
That's his board appointment.
Yeah.
If he'd like to stay on until then, that's fine. As president.
July, we can switch over.
He
What
said
are
he
we
would stay on
missing today?
July, then he flipped over.
Say that again, Dr. Casas.
What are we missing today? I think we're missing Dr.
Brubaker.
Brubaker.
Put him in there.
We
He's not
initially,
here. He should be elected president.
Yes.
we initially nominated him, but he said he was so busy with Houghton College business right now.
What about Dr. Casas?
I think Dr. Casas, you served as board president before Dr. Cusimano, is that correct?
Oh,
It's, I'm just like Joe, I don't know when, I cannot guarantee to attend every meeting. That's the only thing.
It's called the Board of Health. It needs to be a health person, not a sewer.
Yeah, you can.
For a year, Tyler, if you're okay, I will do it for 1 year, and then there'll be enough time for someone.
Yeah,
else, if you
That would be fine. It's only a year appointment anyways. Yep.
Excellent. and then it'll be enough time. Maybe we'll do it. We will rotate. Every year will be one of us, and we won't have a choice in it. Would this be okay?
We can, I wanted to look at the bylaws. We can certainly do something like that. So if Dr. Casas is putting his name in the hat, we'll need a motion to approve Dr. Casas as the Board of Health President.
Dr.
So
Simon,
moved.
right
Seconded.
Or mo-
All right, all those in favor, say aye.
Aye.
Any opposed? All right, thank you, Dr. Casas.
Thank you.
Tim,
Thank
I'm
you, Dr.
saying Vice President for you. I'll entertain a motion for that.
I so move.
Oh, he said no. Tim just said no, he doesn't want to do VP.
He doesn't want to?
Joe.
Sure be long Will's been the president. You step up, Will.
I'm retired.
You only have to fill in if Dr. Casas isn't here.
And he just said he wasn't gonna be here.
He's on Zoom if he's not in person most of the time. I think he's only one than five in here.
That's true.
Okay, Dr. Simon just said he'll do it then.
Okay,
Do need
we
a
will
motion for that?
we'll entertain a motion for Dr. Simons as Vice President.
I'll second.
Do you have a first and second, Brianne?
And Judy.
Okay, all those in favor say aye.
Aye.
Any opposed? All right, the motion is carried. Welcome, Dr. Simons. Thank you. New business, any new business or questions that the board members have or anything at all?
Tyler, I just wanted to mention that speaking with KSL yesterday, more for Dr. Casas's benefit and Dr. Cusimano, but they have reached out to the pharmacies and they're waiting to hear back from some, but basically in a nutshell, KSL is a company, a lab in Buffalo that Tyler and I originally talked to about being doing some PCR testing for the schools. And right now they're reaching out to the pharmacies, the local pharmacies, and asking them if they will swab and do PCR testing for our communities. So that would be the collection point. The pharmacies would get an administration fee basically for swabbing the people. They would have a collection van that would come down here and collect from those pharmacies. And they guarantee right now results to be back the next day. So it gives us another testing option here in Allegheny County. Jones is overwhelmed. We're doing Mondays and Wednesdays. The schools are only doing their teachers, and some of the schools aren't doing their students, and some will. So it's giving students another option. It's giving our community members another option. So one of the questions that came up would be, who are the pediatricians in the area? And I mentioned mostly Dr. Cusimano and Dr. Casas, that if this goes through with the pharmacies, we may ask for a standing order from both of you, that if you're those children's pediatricians, they can, instead of calling you guys and bugging you guys to get an order for the test to get done at the pharmacy, if they're one of your patients, it would just be under an open standing order for Form 18 and below.
About the school position.
Yeah.
Not everybody goes to us.
Yeah, except for those that, that homeschool or some of the private schools ride under the other schools rider. So I will get that information out to you as soon as I hear back from KSL on whether there's 6 pharmacies, I think, independent pharmacies in Allegheny County. And we were trying to get Fillmore, Wellsville, Cuba, and Alfred on. Those were the 4 that we were trying to, since it would kind of hit all 4 corners of the county then.
Jamie, the only problem with the standing order is because it's a standing order, we would need to have the results. You know, we order a test and someone comes back positive. I ordered it. I did not know about it. Something happens to the patient. I never act upon it. I'm liable.
Yep, and that's a question I asked KSL yesterday in my Zoom meeting with them. And they can send results to the doctor and to the parent guardian.
Great.
Yeah. I just kind of wanted to let you know what was going on there. And if those pharmacies agree and go into contract with KSL, then I'll reach out to each of you independently with their template standing order for pediatricians.
Very good.
Dr. Casas, how is Quadrant working out for you as a school physician? Are you seeing those results as well?
I didn't know it was going. Are we doing Quadrant already?
Yes, we've been doing Quadrant, Jamie, for probably what, since this almost the start of school, a little bit after.
Oh my God! So this is the rapid test then, because they are calling it rapid test, and I'm assuming it's the antigen test. So when the nurses say it's a rapid test, it's actually the Quadrant?
So it depends on what school you're talking about. I think Wellsville has some rapid antigen tests. They also have access to Quadrant, which is the PCR. It's not rapid. They ship it off and send it to the laboratory. That's normally for the unvaccinated staff. However, they can offer that to any student if they want to. I don't think Wellsville is one of those schools that's offering that though.
So what schools are doing Quadrant?
All schools are using Quadrant except for Canasarega.
And Alfred Almond.
Yes, and Alfred Almond, sorry. And some of them only use it for their teachers, for their weekly testing. Some are using Quadrant for just their students. Some are going back and forth between different tests so that they don't use up all of the Quadrant tests. So it's an oral PCR. So it's easy on the students, on the faculty staff. Results are coming back pretty quickly. You are named on that, Dr. Casas, as a provider. So you should be able to go in and see any single school that you're a provider for and see any results for the students.
All right, thank you.
And let us know if you're not seeing those or you have any issues with that, or circling back with the schools if they're not including you on some of that information.
Yeah, it doesn't look like I'm being included. I'll check into that.
Okay, and I know a lot of them are not using Quadrant for the students. It's a rarity unless they have no other options. They're sticking with their staff and faculty.
What's the turnaround time?
24 hours for that.
That's amazing.
Yeah, and that's initially pooled, and then if they come back with a positive from the pool, it'll take another 12 to 24 to reflex that to the actual individual.
Yeah, and generally they're staying around that 12-hour mark. That's what we're hearing from some of the schools that use it, is 12-hour for the pool, 12-hour for the individual reflex. So within a day, day and a half, we're getting those results back. So much better than, again, like you are, that's so overwhelmed. Some of those test results are coming back in 4 or 5 days. So.
Yeah, and if they already know ahead of time that someone is symptomatic, they can keep that test separate and they don't have to go through the pool. They can just run it. They can just run it individually and get that sample result in that 12 to 24 hours as well. So that's an option that Quadrant has offered as well. Okay, any other general, and we're moving on to general discussion now. Any general discussion topics? COVID, non-COVID?
Tyler, just one more COVID question.
Sure.
Are we accepting rapid antigen test for return to school when the student is symptomatic?
Yes, so we've left it up to the school physician, so they should be talking with each of you on whether you wanted to accept them. The state has loosened their guidelines because they realize that testing is not widely available. They have loosened the guidelines and allowed that as a return to school option.
They did. And what about the testing to stay? Are any schools doing that?
No, because we have to adopt it as a county. So they were not letting individual schools opt in. We basically had to make the choice for everyone.
And what about testing out of quarantine after 5 days? Are we
We
allowing
have,
it?
we have not been allowing that, only for fully vaccinated individuals. If their symptoms improve and they get that negative test, we're allowing them to go back if they're fully vaccinated.
But if they're not fully vaccinated, they have to do the whole 10-day quarantine.
10-day quarantine, yep. Until the state can operationalize that. I mean, that would just be a huge lift on, not on the testing side, but on the release side for the state. And they cannot figure that out at this point, how to get them out. If someone requests it, I have to entertain it, but we those requests are a handful, if that.
And symptomatic patients who test positive on a rapid antigen test, do they have to do a PCR confirmation, or this is acceptable that they are positive COVID?
We're taking them as a positive as long as they have symptoms. We are recommending they get a follow-up, but it's not necessary.
Okay.
Yep, we are educating them that you really should go out and get one, whether it be molecular or the PCR, but not everyone takes us up on that offer.
And ultimately, we're leaving it up to the schools, Dr. Casas. We had a situation today where an individual wanted to test out and the school said absolutely not. They weren't taking the chance because the school was larger and could not socially distance. They didn't want to take the chance. So the school said, nope, we're making them wait their 10 days. So so we leave that up to the school on how safe they may feel, the different activities that child might be in, or they ride a bus if they're in sports. So and a lot of the schools are still being very cautious about that. They're requiring follow-up PCRs or molecular testing and stuff. If they tested negative with an antigen, they're making them do a follow-up.
Yeah, Dr. Casas, I think I shared the old flow chart with you on the antigen test, and the flow chart, if you're symptomatic at all, there was no requirement for a follow-up. They basically, the chart ended there, but it's the asymptomatic folks, yeah.
Yeah, okay.
But we're certainly willing to follow anything that you've put out to your schools. And I keep telling them that every time they ask me that question. Have you checked with your school physician? You have to be on the same page.
Thank you.
Any other general topics?
Are we seeing an increased rate in the schools, Zahi? Are you seeing increased rate in Wellsville, your school districts?
Yes, well, all the schools are increasing. But I think they do a great job at the schools and, isolating them quickly and, but certainly more and more students are testing positive. And the virus is looking so evasive, like it's looking more of a stomach bug now. Yep. Symptoms are more like vomiting and, they're not the respiratory symptoms like it used to be. So they're really following the CDC guidelines very well and checking symptoms.
The schools have done amazing. I think we've really come into a nice rhythm with them and sharing information back and forth.
It's still way safer to be at school than to be at home.
Absolutely. And that's where we're seeing a lot of our exposures is at home. Mom, dad, they end up with COVID, the kids get COVID. And then, there's that continuous exposure, whether it's through intimate gatherings, social gatherings, having dinners, sleepovers, birthday parties. It's really outside of the schools we're seeing the contacts. We'd love to do, just so everyone knows, we'd love to do test to stay. When we sourced the products for antigen testing, we were told by Abbott that they weren't even taking any new orders until after January 1st, which is really what pushed us over the edge on. We have no resources to even do the testing even if we wanted to. And what we didn't want to happen is if we started the testing and then said, oh, well, we have to stop now. So sorry. We just wanted to keep it consistent. People are in the swing of things right now. There is some complacency, but people are in the swing of things. So we'll reevaluate that. I know the state is really having a hard time even getting those antigen tests. Abbott is really they cannot fulfill the large production and orders for those products. So we're hoping they come back on board, but we'll see after January 1st. Any other questions?
You have something Doc sent? Or did you forget?
Going to sleep.
Make a motion to adjourn.
Okay, got a motion to adjourn, second.
Dr. seconded.
All right, all those in favor?
Aye.
We are
Aye.
adjourned. Thanks, everyone. Thanks for your time.
Good night, Judy.